Hi friends, today we are going to see general consideration in clinical medicine, the practice of medicine. Physician in the 21st century. No greater opportunity, responsibility or obligation can fall to the lot of a human being than to become a physician. In the care of the suffering needs technical skill, scientific knowledge and human understanding. Tact, sympathy, and understanding are expected of the physician. For the patient is no more collection of symptoms, signs, and disorders functions, damaged organs, and disturbed emotions. The patient is human, fearful, and hopeful, seeking relief, help, and reassurance. The practice of medicine has changed in significant ways since the first edition of this book appeared more than 60 years ago. The advent of molecular genetics, molecular and system biology, and molecular pathophysiology, sophisticated new imaging techniques, and advances in bioinformatics and information technology have contributed to an explosion of scientific information that has fundamentally changed the ways physicians define, diagnose, treat, and attempt to prevent disease. This growth of scientific knowledge is ongoing and accelerating. The widespread use of electronic medical records and the internet have altered the way doctors practice medicine and assess and exchange information. As today, physicians try to integrate copious amount of scientific knowledge into everyday practice, it is critically important that they remember two things. First, that the ultimate goal of medicine is to prevent disease and treat patient, and second, that despite more than 60 years of scientific advances since the first edition of this text, cultivation of the intimate relations between physician and patient still lies at the heart of successful patient care. The science and art of medicine. Deductive reasoning and applied technology form the foundation for the solution to many clinical problems. Spectacular advances in biochemistry, cell biology, and genomics, coupled with newly developing imagery techniques, allows access to the innermost parts of the cell and provide a window into the most remote recesses of the body. Revelation about the nature of genes and single cells have opened a portal for formulating a new molecular basis for the physiology of systems. Increasingly, physicians are learning how subtle changes in many different genes can affect the function of cells and organisms. Researchers are deciphering the complex mechanism by which genes are regulated. Clinicians have developed a new appreciation of the role of stem cells in normal tissue function, in the development of cancer, degenerative disease, and other disorders, and in the treatment of certain disease. Entirely new areas of research, including studies of the human microbiome, have become important in understanding both health and disease. The knowledge gained from the science of medicine continues to enhance physician approaches to treatment and prevention. Yet skill in the most sophisticated application of laboratory technology and in the use of latest therapeutic modality alone does not make good physician. When a patient poses challenging clinical problems, an effective physician must be able to identify the crucial elements in a complex history and physical examination, order the appropriate laboratory imaging and diagnostic tests, and extract the key results from densely populated computer screens to determine whether to treat or to watch. As the number of tests increases, so does the likelihood that some incidental finding completely unrelated to the clinical problem at hand will be uncovered. Deciding whether clinical clue is worth pursuing or should be dismissed as a red herring and weighing whether a proposed test, preventive measures, or treatment entails a great risk than the disease itself or essential judgments that a skilled clinician must make many times each day. This combination of medical knowledge, intuition, experience, and judgment defines the art of medicine, which is as necessary to the practice of medicine as is a sound scientific basis. Clinical skills. History taking. The written history of illness should be include all the facts of medical significance in the life of the patient. Recent events should be given the most attention. Patients should at some early point have the opportunity to tell their own story of illness without frequent interruption, and when appropriate should receive expressions of interest, encouragement, and empathy from the physician. Any event related by a patient, however trivial or seemingly irrelevant, may provide the key to solving the medical problem. In general, only patients who feel comfortable with the physician will offer complete information, thus putting the patient at ease to the greatest extent possible contributes sufficiently to obtaining an adequate history. An informative history is more than an orderly listing of symptoms. By listening to patient and noting the way in which they describe their symptoms, physician can gain valuable insight. Infections of inflections of voice, facial expression, gestures, and attitude, body language may offer important clues to a patient perception of their symptoms. Because patients vary in their medical sophistication and ability to recall facts, the reported medical history should be corroborated whenever possible. The social history also can provide important insight into the types of disease that should be considered. Family history not only identifies rare mental disorders in a family but often reveals risk factors for common disorders such as coronary heart disease, hypertension, and asthma. A through family history may require input from multiple relatives to ensure competence and accuracy. Once recorded, it can be updated readily. The process of history taking provides an opportunity to observe the patient's behavior and to watch for the features to be pursued more thoroughly through the physical examination. The very act of eliciting the history provides the physician with an opportunity to establish or enhance the unique bond that forms the basis for the ideal patient-physician relationship. This process helps the physician develop an appreciation of the patient view of the ill system and the financial and the social implication of the illness for the patient. Although current healthcare settings may impose time constraints on patient visits, it is important not to rush the history taking. A hurried approach may lead the patient to believe that what they are relating is not of importance to the physician, and thus they may withhold relevant information. The confidentiality of the patient-physician relationship cannot be overemphasized. Physical examination. The purpose of physical examination is to identify physical signs of disease. The significance of these objective indications of disease is enhanced when they confirm a functional or structural change already suggested by the patient history. At times, however, physical signs may be the only evidence of disease. The physical examination should be methodical and thorough with the consideration given to the patient's comfort and modesty. Although attention is often directed by the history to the diseased organ or part of the video, the examination of a new patient must extend from the head to toe in an objective search for abnormalities. Unless physical examination is systematic and is performed consistently from the patient to patient, important segments may be omitted inadvertently. The result of examinations, like the details of the history, should be recorded at the time they are elicited, not hours later, when they are subject to distortion of memory. Skills in physical diagnosis is acquired with the experience, but it is not merely a technique that determines success in eliciting signs of disease. Okay friends, today we have seen the first page in Harrison Internal Medicine 19th edition. So thank you for watching. Subscribe my channel if you like this video. Thank you.